And now to the pandemic. Just today, Dr. Fauci said that those who got the one-shot J&J vaccine should feel good about an FDA panel's recommendations on boosters. According to the panel, everyone 18 and older who has gotten the one-shot J&J vaccine should get another shot at least 2 months after that single dose. But there is increasing pushback over mandates. Chicago police unions and the city are now at odds over the requirement for officers to report their vaccination status. Here's ABC's Janae Norman.
Tonight, Dr. Anthony Fauci hoping to ease concerns about the Johnson & Johnson vaccine after an FDA panel recommended a booster for the single shot.
I think that they should feel good about it because what the advisors to the FDA felt is that given the data that they saw, very likely this should have been a 2-dose vaccine to begin with.
But Johnson & Johnson telling ABC News there was value in having a single-dose vaccine that could be easily distributed.
In a pandemic situation, the best thing you can do is get out there and vaccinate as much of the population as quickly as possible with one shot.
Unlike Pfizer and Moderna boosters limited to older adults or those at high risk, the FDA panel voting in favor of the J&J booster for anyone 18 and older at least 2 months after getting the single-shot vaccine. As boosters roll out across the country, tonight vaccine mandates facing fierce pushback. A statewide school walkout now just hours away in California as parents plan protests against vaccine requirements for staff and students, and mandates leading to clashes between cities and their police unions. In Chicago, the police union estimated last week that half of its officers were still unvaccinated. The city now fighting it out in court as all city workers, including officers, are required to report their vaccination status or face disciplinary action.
This should have been a very simple issue for us. Get vaccinated, let us know so that we can move forward. But instead, it's become a battle of wits.
The stakes high for all Americans, from law enforcement to healthcare workers, like Michelle Webb, who's been treating COVID patients but was hesitant about getting the shot herself. She decided to get the vaccine after attending educational sessions.
Without that education, I think I would have been really questioning myself, did I make the right choice?
Those mandate showdowns erupting as the CDC released data showing that back in August, the unvaccinated had an 11-fold higher risk of dying from COVID during this surge of the Delta variant than those who got the shot.
The unvaccinated 11 times more likely to die. Janae Norman is joining us tonight. Janae, the CDC and FDA will weigh in on those boosters that you just mentioned this week. And then, of course, all eyes will turn to the FDA panel reviewing Pfizer's vaccine for kids 5 to 11. What's the White House advising states to do right now?
Well, Lindsay, the White House is already telling states to pre-order doses of Pfizer's vaccine for 5 to 11-year-olds in hopes of a seamless rollout that could start in about 2.5 weeks. The FDA already reviewing Pfizer's vaccine for kids. The CDC will meet the first week of November.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.